Almost 1% of people will develop epilepsy during their lifetime. That's 60 million people worldwide. In other words, out of a 60,000 person stadium, about 500 will have epilepsy. New cases of epilepsy are most common among children, especially during their first year. The rate of new cases gradually declines until about age 10 and then becomes stable. After age 60, the rate starts to increase again. Many famous people in history had or may have had epilepsy, including world leaders like Julius Caesar, writers like Lewis Carroll, who wrote Alice in Wonderland, artists like Vincent van Gogh, and athletes like Chanda Gunn, goaltender for the U.S. Olympic hockey team. The causes of epilepsy can be divided into two groups: brain injuries and chemical imbalances in the brain. Anything that injures the brain can lead to seizures. But in over half the cases, no cause can be identified. The type of injury that can lead to a seizure is age-dependent. Seizures in children often are caused by birth traumas, infections such as meningitis, congenital abnormalities, or high fevers. Seizures in the middle years commonly are caused by head injuries, infections, alcohol, stimulant drugs, or medication side effects. In the elderly, brain tumors and strokes cause a higher proportion of seizures. Not all seizures result from a structural problem in the brain. Chemical imbalances also can cause seizures. Common chemical imbalances that can produce seizures include drugs like alcohol, cocaine, and others, low blood sugar, low oxygen, low blood sodium, or low blood calcium. Kidney failure or liver failure can also produce seizures. Doctors will evaluate you for these imbalances by taking a careful history and doing blood tests. Although these disorders and injuries can explain many cases of epilepsy, often the cause of epilepsy remains idiopathic, which is the medical term for unknown. About half the time, no cause for a seizure can be identified. Fortunately, we do not need to know the cause to treat the seizures. Scientists increasingly recognize the importance of genetic factors in the origin of epilepsy. Genetics or heredity are most relevant to generalized seizures, including absence, generalized tonic-clonic, and myoclonic seizures. Defects in genes don't lead directly to epilepsy, but they can alter the excitability of the brain in a way that predisposes it to seizures. Typically, epilepsy develops because of multiple gene abnormalities or a gene abnormality in concert with an environmental trigger. Parents with epilepsy wonder whether their children will have epilepsy. In most cases, they won't, but they do have a higher risk than others. If the mother has a generalized type of epilepsy, the child's chance of having epilepsy may be as high as 5 to 20%. But if a parent has epilepsy due to a brain injury, the child's chance of having epilepsy is only about 5%.
Meningitis. Introduction. Meningitis is a very serious infection of the fluid that surrounds the brain and spinal cord. Meningitis can be fatal. However, if found early, it can be treated. Meningitis. The brain and the spinal cord are the command centers of the body. They allow us to speak, hear, understand, see, move, feel. A clear fluid called cerebrospinal fluid, or CSF, surrounds the brain and spinal cord. CSF is a clear fluid that looks like water. CSF acts as a shock absorber and protects the brain and spinal cord from injury. Membranes called meninges protect the brain, spinal cord, and CSF. Meninges help prevent CSF from leaking to the outside. Meningitis is an infection of the CSF, the fluid surrounding the brain and the spinal cord. People sometimes refer to meningitis as spinal meningitis. Causes. Bacteria and viruses are organisms that can infect the meninges and CSF. When a virus infects the CSF, it is called viral meningitis. When bacteria infect the CSF, it is called bacterial meningitis. Bacteria are bigger than viruses under a microscope. It is important to know whether meningitis is caused by a virus or bacterium so it can be properly treated. Viral meningitis is usually less severe and may need no specific treatment. Bacterial meningitis can be quite severe and may result in brain damage, hearing loss, or learning disability if not treated early. For bacterial meningitis, it is important to know what type of bacteria is causing the meningitis. Antibiotics are essential in treating patients with bacterial meningitis and can also prevent some types of bacteria from spreading and infecting.
Multiple sclerosis, MS, is a disease that affects the central nervous system, the CNS, which consists of the brain, spinal cord, and optic nerves. Everything we do, whether it's taking a step, solving a problem, or simply breathing, relies on the proper functioning of the CNS. To understand how MS may impact the CNS, we must explore the disease at the cellular level. In the brain, millions of nerve cells called neurons continually send and receive signals. Each signal is a minute but necessary part of intricate CNS orchestrations that culminate in the actions, sensations, thoughts, and emotions that comprise the human experience. Normally, the path over which a nerve signal travels is protected by a type of insulation called the myelin sheath. This insulation is essential for nerve signals to reach their target. In MS, the myelin sheath is eroded, and the underlying wire-like nerve fiber is also damaged. This leads to a breakdown in the ability of the nerve cells to transmit signals. It is believed that the loss of myelin is the result of mistaken attacks by immune cells. Immune cells protect the body against foreign substances, such as bacteria and viruses. But in MS, something goes awry. Immune cells infiltrate the brain and spinal cord, seek out the myelin, and attack. As ongoing inflammation and tissue damage occurs, nerve signals are disrupted. This causes unpredictable symptoms that can range from numbness or tingling to blindness and paralysis. These losses may be temporary or permanent.